So good afternoon and welcome to all of you, all the connected participants for this webinar on clinical cases in large animal practice, a fast-track discussion. This is organized by Dr. G.C. Negi, College of Veterinary and Animal Sciences, Chaudhary Shravan Kumar, Himachal Pradesh Krishi Vishwavidyalaya, Palampur, in collaboration with the Caras Laboratories Private Limited, Karnal-based marketing house. Dr. Subramanian Shivaraman is our eminent speaker for today's webinar. Dr. Shivaraman is a renowned clinician with expertise on management of affection in farm animals. On behalf of College of Veterinary and Animal Sciences, being an organizing secretary and host of this webinar, it's my privilege to welcome Professor Mandeep Sharma, Dean of this college, in the inaugural function of this webinar. But just now, we have received a message from Dean Sir that he has some other important assignments and he's not able to join this inaugural session. However, we have received a compliment from Dean Sir for the successful organization of this webinar. I also welcome organizing coordinators, Dr. Pankaj Sood, Professor and Head Department of Veterinary Clinical Complex, and co-coordinators, Dr. Surender Kumar, Dr. Amit Singla, and Dr. Amit Sharma for this webinar. Further, I extend my warm welcome to Assistant Coordinator, Dr. Rajan Sharma from Caras Lab and his team. Dr. Rajan has taken a keen interest in organizing this webinar. I humbly welcome all the participants, including undergraduates and postgraduate students, faculty members, and veterinarians from all over India, as well as overseas. Friends, dairy animal and other ruminants are an important part of our day-to-day life, and they directly or indirectly contribute to the economy of the dairy farmers. Veterinarians always face challenges in the timely diagnosis and treatment of these ailing animals. With various advancements in the diagnosis and treatment of the animal disease, it's very important to regularly update our professional knowledge. Hence, with the aim of enhancing clinical diagnostic services, especially differential diagnostics and therapeutic skills, this webinar entitled Clinical Cases in Large Animal Practice, a fast-track discussion is organized. Today we have Dr. Subramanian Shivaraman, Head Veterinary Clinical Complex from Veterinary College and Research Institute, Salem, Tanuvas with us. He is one of the most learned veterinarian, clinician, academician, and a researcher. Dr. Shivaraman has immensely contributed towards the education and hands-on training of clinical skills and techniques for effective diagnosis and therapeutic management of livestock disease. He has done his doctorate of philosophy and research in clinical evaluation and therapeutic studies in Downer cow syndrome. His expertise and workout are mainly in large animal clinical medicine and mainly include large animal ultrasonography. He has published more than 60 articles. He is quite well known amongst the good number of field veterinarians for his innovations like movable sling for Downer cow syndrome and many other indigenous procedures which are aiding our practicing veterinarians. He has tried to simplify blood transfusion technique in large animal practice, which is now practiced by a number of veterinarians. He has received a number of awards and recognition in his name. We all are privileged to have Dr. Shivaraman with us today, and we are thankful to him that despite his busy schedule, he has humbly accepted our request to deliver this important talk. We all feel that his presence will be helping us to enrich our knowledge in large animal clinical practice. We once again welcome Dr. Shivaraman sir, and the screen is now yours. I request all the participants, if they have any question, you can put your questions in question answer chat box of the screen, and Dr. Shivaraman will be happy to answer your question after the end of this session. Sir, so screen is now yours, and I request you to please start your presentation. Thank you.
Yes, thank you, Dr. Pradeep Sharma ji. Thank you very much. Yeah. Respected Dean, Veterinary College and Research Institute, Palampur, and the organizing secretary, Dr. Pradeep Sharma, and KRS Laboratories, and my dear students and the practicing veterinarians from Himachal Pradesh, Punjab, and all over part of the country. Good evening to everyone. So actually, this fast-track clinical discussion is especially for the fourth year and final year students of Veterinary College and Research Institute, Palampur, who are in great enthusiasm to learn about the clinical cases. So just when the organizing secretary contacted me and to present about a crisp of about 10 or 12 cases, 10 to 11 cases, I accepted, and I have selected some of the most commonly presented cases in the field, which will be useful for our students and the veterinarians. Actually, is this audio is okay, clear?
Yeah, yes, it's all right.
Okay, yeah. Okay. So actually, our students and the practicing veterinarians, this webinar may be helpful for our students and also the practicing veterinarians who are going to have a day-old practice, and the young and the fresh practitioners who are going to attend the cases in the field conditions. So I'm just, I'm not going into the traditional PowerPoint presentation as etiology and pathogenesis like that. I'll be showing some of the clinical signs and nutshell about the treatment, so that I will be tuning you to appreciate the clinical signs and to how to diagnose the case, how to observe the clinical signs. That is the main part of this webinar. After attending the cases, we can go on see the cases regularly. You can add up many more points from this one. So as everyone knows, the learning is a continuous process. During the part of the academic, the college days, we'll be studying for the academic point of the view. And after graduation, we'll be studying for our practicing point of view. So it should be a continuous process. We have to learn as a continuous, then only we will be taking knowledge from cumulatively from everyone, and we can update our knowledge then and there. So why I'm telling this, no, even after graduation only your learning is going to start about the clinical points. So you have to be as an open-minded to accept all the learnings. So I'll get some of the steps for the diagnosis. As a student, when you are going to complete your course and the final year, and you are going for the internship, or when you are going for selection of a area, whether you are going for a small animal practice or large animal practice, according to your comfort and the willing and your interest. So, but basically, as a veterinarian, we should know about all the things, either a small animal practice or the large animal practice. We should not pertain to the small animal alone. We should not pertain to the large animal alone. For example, a small animal practitioner suddenly he got a hypocalcemia case. He should not say that I don't know about diagnosing a milk fever or treating the milk fever. It's not like that. Your comprehensive knowledge should be there for the veterinarian, and you have some specialization in small animal or large animal like that. Likewise, when a large animal practitioner, when he come across attending a case of CKD, chronic kidney disease, or treating a case of parvoviral enteritis, he should not say, I don't know about the canine. So we should have a comprehensive knowledge of all the things, either small animal or large animal. And as a veterinarian, you have to attend all the cases as a basic knowledge. And coming to the large animal practice, it is a challenging one, and also gives satisfaction and more satisfaction and recognition from the farmers. When you make a success of the any cases, the farmer will be remembering you forever in that village, and will be getting credit from him, and he will be telling all others in the village that this doctor has saved my animal. Like that they used to tell. So we have to, whenever you are attending the case, you have to give the attention with dedication and sincerity, so that the cases should be observed well and it should be treated well. So since the lack of time, within I have to finish it before 1 to 1.5 hours, let me go in a crisp manner. So whenever you are attending the case, observation is most important. Clinical point of the view, the observation of the case is most important. When you are getting the history and asking the owner what happened, what treating they have given, what happened, what about the ailment, what about the calving history, what about the lactation, whether there is a reduction in the milk yield, and all these things you will be asking. No, the same time you have to observe the animal while getting the history. Observation is very much keen, so that it will give lot of clue in the diagnosis. And clinical examination is the other most important point of the view, and you have to do the clinical examination not in a hurry manner with the patients. Within 3 to 5 minutes, you can entirely screen all the systems from the the respiratory tract and to all the systems GI tract, everything. Within 3 to 5 minutes, you can have a crisp clinical examination, like taking the temperature, seeing the heart rate, and seeing the mucous membrane. All these things. How about the dung, rectal examination? All these things are very valuable thing. Then go for the confirmed diagnosis. As an experienced clinician, we may be knowing many cases. Just by seeing that, we can say this is this type of case like that. But sometimes we may miss that case, mimicking some other clinical conditions. So that you have to do the clinical examination, then you go for the confirmation of your diagnosis. Then appreciation of the clinical signs is the most important one. As we are studying the textbook, suppose in the tetanus, you might be studying a Sahar's appearance means only after seeing the case, when you are attending a case of tetanus, by seeing the stiffness of the forelimb and the hind limb, the animal walking like a toy, and the Sahar's appearance, then you can remember it. You will be studying prolapse of the third eyelid. Unless otherwise you see the prolapse of the third eyelid, you cannot able to appreciate. You can imagine only. So appreciation of the clinical signs is the most important one then, so that you can go for a very good, clear-cut, crystal clear diagnosis. And clinical examination is an art, and diagnosis is also an art. Clinical examination is a skill. We have to learn the examination skill from our seniors and the teachers, and the diagnosis is an art. For example, you have to use a stethoscope, means you have to use in all the needy and unnecessary cases. The stethoscope plays an important role in identifying the aspiration pneumonia, abnormal heart sounds, pericarditis. You can see whether this animal is having tachycardia or bradycardia. It gives a lot of important interpretation in the large animal practice. In case of abomasal displacement, in case of assessing rumen motility, everything is important by using the stethoscope. So clinical examination is an skill and diagnosis is an art. So you have to learn these techniques slowly in your practice. And in future, we will be dealing more sessions regarding the clinical examination and diagnosis. In this one, I will be pertaining to some particular cases and how to approach that cases, what are all the do's and don'ts in such a cases, so that you can have a cumulative and crisp knowledge. And when you are attending a case, you will get there some points which may be useful for your practice. So regarding the case one discussion, see this animal is in the lateral recumbency, and the entire rumen content is regurgitated. The animal went for lateral recumbency and collapsed. What is the color? Can you able to see the color of the rumen content? It is milky white in nature. It's a clear case of ruminal acidosis. So normally the rumen pH will be alkaline. I mean 6.7 is the normal pH of the rumen. So in case of acidosis, there will be decline in the rumen pH. Here the rumen fluid liquor is milky white in color. So milky white in color with sour odor is a clear indication of ruminal acidosis. This is an acute case of ruminal acidosis. The animal went for lateral recumbency. All the rumen contents are regurgitated. The animal is in severe dehydration, and the animal went for shock and death. So by seeing this rumen liquor itself, you can able to diagnose it's a clear case of acidosis. Why I am telling, if you are not able to identify, you can put the stomach tube intubation. You can put the stomach tube and you can remove the rumen content. You can see the rumen content. You can see the protozoa, and then you can assess the clinical conditions. The simple thing, the ruminal acidosis is mainly, as you all know, the overfeeding of concentrate. I mean, every farmers, they used to say, we are feeding concentrate for a long period. So of course, but sudden engorgement of the carbohydrate, more engorgement, sudden immediate engorgement with more quantity of the carbohydrate, especially this rice gruel, rice, kitchen waste, all these things, sudden engorgement will lead to rapid proliferation of S. bovis in the rumen, and it will lead to accumulation of lactic acid and lead to ruminal acidosis. So here, it's a clinical point of the view, you have to ask the history, what type of feed they have given, and you have to go for the 2 or 3 main clinical examination. One thing is the palpation of the rumen. You should be able to palpate and appreciate the fluid splashing sound. So the farmer will be telling the animal is not taking feed, reduction in the milk yield, or inappetence to complete anorexia. The animal is passing loose dung. So semi-solid or loose dung with the fluid splashing sound in the rumen is a clear case of ruminal acidosis. Just by seeing a clinical examination, you can find out. See, just you can palpate the rumen like this, and you can able to appreciate the fluid splashing sound. So you have to go near and you have to palpate like this, and you can easily appreciate. You can diagnose the ruminal acidosis in just 30 seconds, more than sufficient. Just by asking the history palpating the rumen, appreciating the fluid splashing sound. The animal will be having semi-solid or diarrhea will be there, inhabitants anorexia. So variable degree of clinical signs will be exhibited. So this animal is standing, having ruminal acidosis. It's a case of mild ruminal acidosis. Whenever the animal is having staggering gait, it can be termed as moderate. So when the animal go for sternal recumbency or lateral recumbency, it is a case of severe acidosis. So palpating the rumen and appreciating the rumen fluid splashing sound is very, very important. And you see this animal here, morely sheep and goat are more prone for like a cattle also sheep and goat are more cases are presented for ruminal acidosis. See this animal, is it alert? No, it is not alert. It is dull and depressed. It is the sleepy behavior. It is as if it is sleeping. So like this type of cases, whenever it is presented to you with a semi-solid dung, you have to examine a rumen and rule out ruminal acidosis. So as I told, with the palpate the rumen and appreciate the fluid splashing sound, then you can put the stomach tube and evaluate the rumen contents. So just 30 seconds, you can appreciate the clinical signs and you can diagnose. So you can introduce the stomach tube. So you can use any type of, small tube, that garden hose tube are available that you can lubricate and you can use it as a stomach tube and you can drain the rumen content. See? This animal is dull and depressed and is unconscious about the environment. It is in the sleepy behavior. Just you palpate the rumen and find out whether there is fluid splashing sound is there or not. Then you go ahead with the other procedures. So if you have doubt, then after getting the fluid splashing sound, you will be introducing the stomach tube. I think the video is not playing. Yeah. I'll get back to the video and show you. I'll get back the video after some time. So like that in large animal also, in small animal you can use a small tube and you can evacuate the rumen content. In large animal also you can use the rumen fluid extraction pump is available. Like this rumen fluid extraction pump is available, or otherwise you can use this type of a small hose pipe, not more than ½ inch, and you can evacuate the rumen content very easily. So you see here the rumen content is gushing out. So it's watery in nature and undigested feed materials are coming out, and you can very well appreciate the rumen contents. And you can see the protozoa and you can see the pH. Sometimes you may be getting large volume of rumen liquor with undigested feed material. Sometimes it may be the distended rumen. Sometimes in vagal indigestion it will be there. Ruminal acidosis also it will be there. As I already told, if it is a milky white in nature, that is also due to ruminal acidosis. So this type of stomach tube is available. That also you can use it. It's a puddling machine that you can collect it. The rumen liquor can be collected by using this apparatus also. So when you get the rumen content like this, it is milky white in nature. You need not go for seeing the protozoa under microscope. You can obviously say it's a case of ruminal acidosis. So sometimes when you put the stomach tube, you cannot able to get the rumen content. Whenever it is a fluid, it will come out. If it is a frothy in nature, it won't come out. So the rumen content, the rumen fluid, it won't gush out. So what you have to take the tube and put it in the down like this in the kidney tray, and you can see it will be a semi-solid in nature. The rumen content will be semi-solid in nature, and you can see the small frothy bubbles are there. This is due to frothy bloat. Ruminal acidosis with the frothy bloat sometimes also occurs. So that also you can easily differentiate by using this type of stomach tube intubation. So some animals will be exhibiting diarrhea like this, semi-solid diarrhea, inhabitants will be there, reduction in the milk will be there. That is also a condition of acidosis or subacute ruminal acidosis, SARA. We used to call it as SARA, subacute ruminal acidosis. And see here the large volume of dung material is present. Sometimes undigested feed materials will be there in the dung material. Undigested feed material will be there. That is also due to SARA, subacute ruminal acidosis. So regarding the treatment, you have to go for the first and the foremost treatment is remove the rumen content. As already shown the video, put the stomach tube and remove the content, rumen content. That will be the more adding the advantage for your treatment. The recovery rate will be more. Many times we used to give sodium bicarbonate with normal saline and treat the animals, but you won't be getting that much result. When you remove the rumen content and then you can treat it, the result will be more successful. So when the animal is in the coma stage or the lateral recumbency, you should not put the stomach tube intubation. You have to stabilize the animal, then only you have to put the stomach tube. And regarding the treatment with the sodium bicarbonate should be mixed with normal saline only. It should not be mixed with the D5 or D20 or ringer lactate. It should not be. Okay, it should be mixed with normal saline and give IV slowly. And regarding the speed, many people they used to ask whether we can give it slowly or not. There is nothing like that. Like calcium, okay, like calcium we used to give very slowly. Magnesium we used to give slowly. Not here, it does not matter. So you can mix it with the normal saline and you can give it in the as usual full speed. You can give no problem, no issues. Okay, and only the thing you should not mix it with DNS or D5 or RL. And also in case of ruminal acidosis, you should not go for DNS solutions or hypertonic dextro solutions. You should not use. But ringer lactate can be used as a fluid therapy. That is no issues regarding that. The primary treatment is sodium bicarbonate with the normal saline. I will tell you how to calculate the sodium bicarbonate dosage. And after stabilizing the animal with the sodium bicarbonate and the normal saline, and you have to give the animal oral antacids. Many number of oral antacids are available, like aluminum hydroxide, magnesium hydroxide solutions, or magnesium carbonate are available that you can give orally. And B complex injection should be given. That will enhance the stimulation of TCA cycle, and it will enhance the pathway of lactic acid, accumulated lactic acid into the TCA cycle part. So this type of protocol will be giving you the great success in the treatment. The another important thing is the cut transplantation. Many of the veterinarians, they used to give cut transplantation on the same day. You need not give the same day. Now we are treating the animal in the same on the day old. First day you are treating the animal with for ruminal acidosis. You wait for the 1 or 2 days. In the follow-up only you are going for cut transplantation. What is called cut transplantation? It is getting the rumen content from the healthy animal and drenching to the affected animal. So because of lactic acid accumulation in the rumen, the entire rumen microflora is completely destroyed, and there is no protozoa in the rumen fluid, and you have to get it from the healthy animal. So how to transplant? So you can advise the farmers to get it from the healthy animal. You can collect it. You can collect the rumen liquor from healthy animal. You can drench it, and you can go for 2 to 5 liters and drench it, and it will the rumen protozoa will be transplanted. Then the animal will start taking it. Probiotics, if you are not getting to do the cut transplantation, probiotics can be given, like many number of probiotics are available in the market that you can give it in the bolus form. Okay. We can whenever you are collecting the rumen content, it should be given to the animal immediately. You should not keep it in the fridge. You should not boil it. You have to collect it fresh and you have to give it to the affected animal. That is gives a wonderful result regarding the cut transplantation. Regarding the fluid therapy makes a lot of difference in the success of the treatment of ruminal acidosis. You can treat it, if the animal is severely dehydrated, you give the fluid therapy according to the body weight. Okay. And the selection of fluids for fluid therapy, you can give normal saline. Normal saline can be given or ringer lactate given. Why we are giving ringer lactate? Ringer lactate is electrolyte solutions. The primary treatment of acidosis is sodium bicarbonate with the normal saline. Here for fluid therapy, you can use either electrolyte balanced electrolyte solutions or normal saline can be given. And fluid therapy makes a lot of difference in giving the success rate of the animal. So how to calculate the dose? How to calculate the dose of sodium bicarbonate? Here, for this academic point of the view for the students, you can take it as a 0.3 into base deficit into body weight. So this is the formula that will give the milli equivalent of sodium bicarbonate. So 0.3 into base deficit into body weight. So base deficit is a constant. So here I have given mild, moderate, severe according to the clinical science. So in the 11th edition, veterinary medicine 11th edition, in the ruminal acidosis chapter, you can able to see a tabular column which is clearly mentioned how about these mild, moderate, severe cases, and according to that clinical science, you can make it as a mild, moderate, severe. For example, the animal is walking, is having fluid splashing sound, semi-solid dung, reduction in the milk yield, inappearance. You can term it as mild. The animal is having staggering gait. The animal is having staggering gait, incoordination, and dull and depressed, and diarrhea is there. Respiratory distress is there. That is a moderate. When the animal goes for sternal recumbency or lateral recumbency, increase in the heart rate, you can term it as a severe. So based on the clinical signs, you can make it as mild, moderate, severe. So 0.3 is a constant, and the base deficit according to the mild, moderate, severe, you can add it, and according to the body weight, you can calculate and do it. For example, a 30 kg body weight goat is having mild, means mild form is 0.3 into 5 into 30. That will give the milli equivalent of sodium bicarbonate. So for example, 45 means 45 milli equivalent of sodium bicarbonate. So we are having sodium bicarbonate ampules are available. 7.5% sodium bicarbonate solutions are available as a 10 ml and 100 ml bottles are available. Each ml contains 0.9 milli equivalent approximately. Okay, each ml contains 0.9 milli equivalent. So approximately 1 ml is equal to 1 milli equivalent. So 1 ml is equal to 1 milli equivalent. Suppose in the calculation you are getting 45 milli equivalent of sodium bicarbonate, means you have to get 45 ml of sodium bicarbonate and mix it with normal saline, 1 sachet of normal saline, and give IV as usual. No, no regulation of speed and all. Okay. Suppose you are getting the calculation 600 ml of sodium bicarbonate. You add 600 ml of sodium bicarbonate in normal saline solutions to many bottles. You can infuse it and you can give it IV. Okay. So when you are giving to small ruminants, in my practice, I used to give the large animal and sometimes directly also, or mix it with the normal saline is the best one, because when you give it directly, for example, the small ruminants, rapid alkalinization will lead to the shock of the animal and sometimes it may collapse. So always the better thing to avoid untoward reactions, you mix sodium bicarbonate with the normal saline solution and give IV. Okay. So either in a sheep and goat, don't give sodium bicarbonate directly. And if you are giving directly, if you are giving very fast, the animal will collapse immediately. Sometimes it may lead to untoward reaction. So take care. You mix it with the normal saline, give IV. So when you go for the calculation, and naturally you will come in your practice, you will come to know how much of the quantity we need for the animal, so that the success rate will be more. This is regarding the ruminal acidosis. The next thing is regarding the bloat, how to approach a case of bloat. In bloat, there are two conditions. One thing is the free gas bloat and frothy bloat. So understand, one thing is free gas bloat. So free gas bloat means when you put a stomach tube, immediately the gas will be released and the left paralumbar fossa will be sunken. Okay. So what is bloat? When there is any tympany, bloat is otherwise called as tympany, there is a distended rumen. There is a distension of the left paralumbar fossa. Distension of the left paralumbar fossa is called bloat or tympany. So that is termed as two things, free gas bloat and frothy bloat. Free gas bloat etiology is sometimes any choke material. So any foreign body that obstructed in the esophagus, like vegetables, beetroot, potato, or whatever may be the things that gets obstructed in the esophagus, that will lead to choke. So because of the choke, the rumen gas is not gets liberated, so it gets tympany. So acute tympany will be noticed. So when you remove the choke, you can relieve the gas. So when you put the stomach tube, gas will be released freely. So that is occur only in free gas bloat. So when you are putting the stomach tube and you are not getting relieved the gas from the rumen, it could be a frothy bloat. So it will be a frothy bloat. This is why you can able to very easily differentiate the conditions. You may be studying bloat in the textbook, the etiology and other all conditions is well and good, but clinically you can term it very simple, free gas and frothy bloat. And sometimes when we are having in tetanus also, whenever you introduce the stomach tube, immediately the gas will be liberated. After 1 hour or 2 hours, again the tympany will be present. So you have to rule out the signs of tetanus also. These are all regarding the free gas and recurrent tympany. In some cases, you will be having recurrent tympany again and again. Sometimes you put the stomach tube and you will be relieving the gas, and sometimes again it will have. Otherwise, you will be treating for some bloat with anti-bloat agents. Again, the animal will be having recurrent bloat. You have to think about diaphragmatic hernia and non-penetrating foreign body in the rumen. And sometimes the pastoral bloat, all these things lead to pastoral bloat, lead to frothy bloat. Okay. Sometimes there may be some obstruction in the cardia. So mainly because of amphistomes. I have seen some cases because of amphistomes also, you used to get sometimes recurrent tympany. So for example, amphistomes, they are immature amphistomes, they are present in the duodenum. So after doing maturation process, the mature amphistomes, they will reach the rumen. All these matured amphistomes, they will sit in the rumen wall, they will stick onto the rumen wall, and they will stick onto the cardia. So when they are obstructing, when they are sitting on the cardia, they get obstructed and they will prevent the eructation process. So the animal will be having recurrent tympani. In such a cases, if you are treating that animals with oxyclosanide, it will respond very well for the treatment. Oxyclosanide 18.7 milligram or 18.5 milligram per kg body weight. Once in 48 hours, 2 doses means it will work well. So you have to differentiate each and every conditions by clinical examination. How will you identify it is due to amphistomes? When you put the stomach tube and you are getting the rumen content, in the rumen content you can able to see the small, like a pink color organisms, like a pomegranate. When you open a pomegranate, there will be a pink color thing inside, the same thing like objects, it will be having jumping here and there in the rumen content. It will be jumping in the rumen content, so that you can easily find that is nothing but mature amphistomes. So these are all very simple to diagnose the condition. So for example, in a free gas bloat, so the animal is having choked material in the esophagus, means that naturally the animal will be having extended neck. The neck will be extended with the profuse salivation will be there. The animal will tendency to have frequent jerky coughing, and because of the obstruction, there will be tympani, acute tympani will be there. The animal will be having respiratory distress. So extended neck with salivation and the frequent cough, jerking cough, you have to think about choke material, any choke in there, and you have to palpate the esophagus. And always the veterinarians, they will mistake by palpating the trachea. So here, when you palpate the trachea, so you will be feeling the Adam's apple here, and whatever you feel, the same thing you'll in mind, it will imagine as if you are palpating. See, for example, if you are thinking as something potato like this, means when you palpate, you will be seeing some potato like I think I got obstructed here in this area. So here is a trachea. So behind the trachea is the esophagus. So you should not palpate or press the trachea. Behind the trachea is the esophagus. There you have to palpate and find out what is the material which is get obstructed. Then you can introduce the stomach tube slowly. It will go to a particular area and get struck, and there you can see, you can palpate very easily. Then with the help of the stomach, with the help of the mouth gag only, you have to remove the this one, foreign body. Otherwise, what will happen? You should not put your hand inside the oral cavity of the cattle anyway. So sometimes whenever the farmer says some potato or some foreign body gets obstructed in the esophagus, they will say we will catch the hold the oral cavity. You can take the obstructed material. They used to say you should not put your hand at any cost. So only with the help of the Gunther's mouth gag only you have to put your hand inside. Otherwise, you should not put your hand inside the oral cavity. It will the sharp molar teeth will bite your hand and you will lose your fingers. Okay, that you have to take care. So the animal is restless. You can give you can sedate the animal with 0.25 ml or 0.5 ml of xylazine, and the diazepam can also be given 1 or 2 ml slow IV, so that the esophagus gets relaxed. The animal can be restrained well. Then you put the mouth gag, ask 2 persons to hold it. Then you can put your hand deep inside the oral cavity and you can reach the esophagus. One person, you will be pressing the foreign body from the downward position and bring it to the proximal end. Then you can catch hold of the foreign body and you can easily take away. It's a very simple procedure. Once you have done it, means it is very easy to relieve the choked material. So this is regarding the choked material which leads to free gas bloat. So without mouth gag, you should not do the procedure. Okay, that is the take-home point. See here is a recurrent tympani, persistent tympani. When you put the stomach tube, the gas will be released. Again, it will come. See, the animal is having distended left paralumbar fossa, and you see the ear of the animal, it's erected, and it is a case of tetanus. So it's not having full clinical signs. So locked jaw is not there. Now only the clinical signs are progressing. So by seeing this type of erected ears and extended neck, recurrent tympani, you rule out the possibilities of tetanus also, so that you can diagnose it very easily. See here also the erected ears are there, the recurrent tympani is there. The animal while walking and when it is turning, it will turn like a toy. as a sawhorse appearance, and it will turn like a toy, and you can very well easily appreciate the clinical signs. So some of the practitioners, they used to, in case of tympani, they used to put the trochanter needle in to relieve the gas. Of course, we can do it. In which case we can put the trochanter cannula or needle puncture in the rumen? Only in case of free gas bloat. So in frothy bloat, there is no need of putting the trochanter cannula or the needle, because in frothy bloat, when you put the trochanter cannula, the gas won't be liberated. Okay, that we have to take care. See here, frothy bloat. So when you are introducing the stomach tube and seeing the rumen content, when you are introducing the stomach tube and taking the rumen content, and the rumen content is not coming out freely as if the watery in nature, it will be semi-solid in nature because of the feeding pattern. So it won't come out. So you have to take the other end and you have to put it down on the kidney tray, and you can see the rumen content, which is having small frothy like bubbles are there. Small frothy like bubbles are there. This is nothing but frothy bloat. It's a clear case of frothy bloat, very easy to diagnose. Okay. So when the animal is having tympani, this type of animal, when they are having tympani, there is no need of putting the trochanter cannula. So of course, trochanter cannula is a life-saving one, but it is in the case of free gas bloat. When it is having frothy bloat, if you do the procurization or put the needle, or even if you are pressing the rumen, the gas won't be getting liberated. Why? The reason, the rumen, all the gases are trapped in the bubbles, air bubbles, and trapped inside, and it is not getting liberated. You have to liberate, you have to coalesce the air bubbles by administration of some anti-bloat agents. Then only the air will be liberated. So there is no need of doing procurization in case of frothy bloat. So regarding the line of treatment in the frothy bloat, you can give liquid paraffin, 500 ml to 1 liter you can give, and you can give antacids, magnesium hydroxide or aluminum hydroxide preparations which contains silicone dimethicone. So many of the veterinarians, they used to give 1 bottle silicone dimethicone, just 1 bottle, 100 ml orally. It is not at all sufficient for a large, very huge rumen vat. So you have to give minimum 400 to 500 ml oral administration should be needed. Or otherwise, you can go for an administration of vegetable oils, coconut oil or any vegetables oil can be drenched without any aspiration. So these three are the choice of treating the frothy bloat, but don't combine all these three things. You should not administer liquid paraffin, antacids, and vegetable oils. You do any one. You select any one according to your availability and the comfort. And all the antacids with the silicone dimethicone are commercially available in the market that you can very well use. Okay. Or vegetable oil or liquid paraffin. Whichever you are drenching, make ensure it should not get aspirated. That is the most important thing. So many of the veterinarians, they used to treat all these things, but there won't be any immediate recovery or any other result oriented may not be there. So what is the reason? Because they would have not preferred for fluid therapy. So you have to go for fluid therapy. Fluid therapy is a must. Sometimes the frothy bloat may be combined with ruminal acidosis. In that condition, you have to go for sodium bicarbonate with the normal saline. Or only frothy bloat is there, you can go for electrolyte, balanced electrolyte solutions. Ringer lactate, you can give 5 liters or 6 liters of fluids. So I will tell you how to give. So 5 liters or 6 liters of fluid in the field conditions, how it is possible. Now we are having large animal, infusion IV set is available. Within 10 minutes, you can give 5 liters of fluids. I'll show the IV set picture that you can get it. So here you can give silicone dimethicone with antacids, 500 ml, and fluid therapy, and the result oriented will be very nice. Within 6 to 8 hours, you can have the drastic reduction in the bloat. The animal will recover normally. So during the treatment process and the follow-up, you have to advise the owner not to keep the animal lying down. Go for recumbency, because during the acute tympani in the frothy bloat, when the animal is going for recumbency, this rumen will go and press the diaphragm, and sometimes it will lead to asphyxia and the death of the animal. So how to make the animal stand means you have to stabilize you correct the dehydration, the animal will become normal and it will be in the standing posture. Some veterinarians used to advise putting a stick in the oral cavity. Just to put a stick in the oral cavity and tie it, and the animal will be going on chewing the stick. That will lead to salivation. The salivation will enhance the maintaining the rumen buffer mechanism, and it will be having a very good effect in maintaining the rumen pH and rumen buffer mechanism. So it will reduce the frothiness very easily. So when after administration of this one silicon dimethyltryptamine after result after 6 to 8 hours you will be getting the difference. If there is a tympani is there, you go for another dose of after 8 hours and fluid therapy. Recurrent tympani after treating the frothy bloat, recurrent tympani means, as I already told, you rule out diaphragmatic hernia and non-penetrating foreign body. These two things, vagal indentation. These three things you have to keep it in mind. Diaphragmatic hernia and vagal indentation you have to keep it in mind. Otherwise, if it is a feed-oriented frothy bloat, with this above treatment, the animal will recur in 1 or 2 days. The other, the next one is the case 3 is a goat is not able to walk properly and having staggering gait, and torticollis means you know that it is having the flexion of the neck laterally, and ataxia, suddenly it will fall down. So we'll be getting lot of neurological cases in sheep and goat in the field conditions. In that, the owner will be reporting that feeding habit, everything is normal, dung and urine is voided normally, and the animal is having staggering gait, incoordination. And if you are not treating the animal, then the animal will go for lateral recurrency and pedaling will be there. And sometimes the animal may be going for continuous bleating. So this type of clinical signs you would be coming across in many number of cases in field conditions. And it's nothing but Polioencephalomalacia. Okay, see, you can see the nystagmus. You can able to see the nystagmus. Either it may be horizontal nystagmus or vertical nystagmus. So not only in the recommends the animal, even in the standing posture also, when the animal is presented, you see the eyeball, whether it is moving or not. So when the animal is having incoordination, slightly going and hitting the wall or getting support of the wall, and movement of the eyeball up and down or lateral side, means you think about Polioencephalomalacia. Polioencephalomalacia is thiamine deficiency, vitamin B1 deficiency due to overfeeding of sudden engorgement of carbohydrate will lead to ruminal acidosis. For overall period, they are giving only concentrate alone. There is lack of fiber material that leads to development of some bacteria, Bacillus thiaminolyticus in the rumen, that will block the synthesis of thiamine. So once the thiamine is synthesis is blocked, the animal will go for thiamine deficiency. They will show neurological signs. All these type of neurological signs will be there. So that is called polioencephalomalacia, otherwise called as cerebrocortical necrosis. See, the feeding habit, everything will be normal. When you make the animal stand, it cannot able to stand. During the lateral recurrency, it will be having frequent pedaling will be there, but feeding habit will be normal. So when you make the animal to put on one side, it will try to get up on the other side. It won't lie on one side. This is the pathognomonic clinical sign to identify Polioencephalomalacia. In all other cases, suppose if you are getting confusion, okay, in case of ruminal acidosis or pregnancy toxemia, any other case, when you put the animal on one side, it will be lying on the same side only. So when you put here in Polioencephalomalacia, you try to put it the animal in this side and that side. Any one side, the animal will be trying to get up again. That is one of the pathognomonic sign of to identify Polioencephalomalacia. The pupil will be dilated. Okay, apparent blindness will be there. So nystagmus, dilatation of the pupil. See here also, the animal is having staggering gait and trying to get up. So incoordination will be there. Nystagmus is there. When you feed the animal, it will take feed everything normally. When you put the animal on one side, it will try to get up on the other side. So all these are the signs of classical signs of vitamin B1 deficiency, Polioencephalomalacia. The animal will very well respond to injections of thiamine. Okay, so the animal is trying to get up. So this type of clinical signs you never miss in the field condition. The earliest sign, the animal will be separated from the flock. It will get support of the wall. Nystagmus will be present. The animal will having incoordination and wide based stand of the forelimbs or hind limbs. See here, the animal is standing like this and staggering gait is there. Dung will be normal, pellety in nature. So this type of the animal won't lie down. If you make the animal lie down, it won't lie down. So this is Polioencephalomalacia. Sometimes you may be getting like this, means this is a clear case of tetanus. See here, all the forelimbs and hind limbs are stiff. The locked jaw is there, raised gut is there. In Polioencephalomalacia, raised gut will be there. I mean, the opisthotonus will be there, but the limbs are not stiff. Oral cavity is not locked. So you can differentiate very easily. Okay. So here, the oral cavity is not locked. Opisthotonus is there. and extended limbs are there. So you have to differentiate from polioencephalomalacia and meningitis. Okay. So supplementation of thiamine will give you a very good result. So thiamine, many number of preparations are available. You can select it thiamine and give 10 to 40 milligram per kg body weight, IV or IM can give. So normal dose is 10 milligram per kg body weight every 6 hours. I mean for 40, you cannot give 4 times a day. So is to combine 40 milligram per kg body weight and give it IM or IV. So you should not use the liver extract preparation. You keep it in mind. Whatever the preparation you are having, you should not use the liver extract preparation as a IV preparation. So that will lead to anaphylaxis. So you should see the label whether it is IV or IM. IM means you give IM. IV means you can give IV preparations. And you can don't give any vitamin preparations direct IV. Many veterinarians I used to see, they used to give direct IV, the B complex. You should not give. In sometimes it may lead to anaphylaxis. Sudden untoward reactions may come. So they used to say no, untoward. I have seen in many number of course, it's well and good, but many number of cases you lose that. So you mix it with normal saline or dilute with distilled water or normal saline, give slow IV. I used to give with 100 ml of normal saline and mix the thiamine, vitamin B1 and give IV. Excellent result will be there. If you are not able to give IV, you can give IM. Okay. How many days you have to give? You can give till the animal recovers normal. Usually we used to get 3 to 5 days the treatment, then will become excellent result will be there, then it will become normal. Earlier presentation, very good result. Delayed presentation, the result will be variable. Sometimes the animal may be recommended for 1 week and they are bringing means it cannot be bring back to the normal because cerebrocortical necrosis leads to irreversible damage of the brain. So it's very much very well appreciable in the field conditions. We can try it and we can be happy by seeing the recovery of these type of cases. The same thing in large animal also and heifer also it is coming. Nystagmus with the coordination and neurological science, you treat it with the thiamine. That is called Polioencephalomalacia. And next thing you would have come across this type of cases in sheep and goat and also in large animal. The protrusion of the conjunctiva, edematous and protrusion of the conjunctiva like this will be there. That is called the chemosis. That is condition is called the chemosis. Here blood injury is there because the animal got eroded some surface, some of the superficial surface it got eroded with some objects and it got bleeded. That's otherwise in most of the cases you don't get bleed. Only the protrusion of the conjunctiva alone will be there. It is mainly due to some unknown plant toxins which leads to allergic conditions. That is called the angioedema. That leads to this type of chemosis. Either it may be unilateral or bilateral. Okay. So this is after the treatment. The next day, immediately after the treatment, it recovered well. So just giving antihistamines, it works well. So just to give antihistamines, you apply some opticaps, chlorotetracycline opticaps, or chlorophenicol opticaps, or oxytetracycline opticaps. Any opticaps you just apply, and you just give furosemide and antihistamines. Immediately, the next day the animal become excellent result will be there, become normal. This is before treatment and this after treatment. In 1 day, it got excellent results. And the other one is the pink eye. See here, you might have come across this type of conditions in the sheep and goat also. Either it may be unilateral or bilateral. Unilateral means one side, bilateral means both the sides. You will be getting a case of corneal opacity, discoloration of the cornea, and conjunctivitis will be there. Sometimes ocular discharge will be there. Sometimes one animal in a flock you will be getting, and within 2 or 3 days, many number of animals are affected. The one will be saying some 10 animals or 20 animals are having the same condition. In sheep and goat and cattle also will be getting the same type of thing. This is nothing but the pink eye. Here there is no systemic normal. The feeding habit, everything will be normal. All the activities, vital signs, everything normal. Only they accept the this discoloration of the cornea. Sometimes in severe form, corneal ulcers may also develop. So this is, see this picture also, cloudiness and the corneal opacity is there. In sheep and goat, mainly this is due to the infection of chlamydia. So chlamydia and mycoplasma. These are all the main thing which involves in the etiological agents of infectious keratoconjunctivitis. In cattle, Moraxella bovis is the causative agent of pink eye, infectious keratoconjunctivitis. So in sheep and goats, respond well to enrofloxacin, oxytetracycline, streptopenicillin, or you can combine with this tylosine. Tylosine you can give 10 milligram per kg body weight intramuscular. Apart that, you can use any one of the antibiotics like enrofloxacin, streptopenicillin, or you can give oxytetracycline and give some opticaps, as I already told, chloromycetin opticaps, or you can use chloramphenicol opticaps. Any oxytetracycline opticaps can also be used. In cattle, you can use the same thing, enrofloxacin, streptopenicillin, or oxytetracycline with IV ointments. It will recover in 1 week. So this is infectious keratoconjunctivitis. So coming to the case of next thing, when there is a animal, when a cow is presented to you with swelling in the mandible. So when a cow is presented with a swelling in the mandible, how to approach these type of cases? So progressive swelling in the mandible. So sometimes the owner may be reporting a hard swelling in the mandible near the cheek teeth, the second or third molar teeth, which is hard in nature and progressing day by day, increasing day by day, and it is progressing as swelling is there. When you palpate, it is very hard in nature. You think about actinomycosis. Okay. When it is a soft fluctuating in the submandibular region, the jowl edema, that is mainly due to hypoproteinemia. That is due to worm infestation. Okay. Sudden swelling in the mandible, a big head like thing, you have to think about any snake bite, snake envenomation. Okay. Facial edema with edema in the ears and all, sudden swelling of the eyes, ears, and the head and all. You have to think about angioedema, any allergic conditions that is due to any other plant material. That all these things you have to do by clinical examination and narrow down the diagnosis. So facial or mandibular swelling, you have to think about actinomycosis. As already told, actinomycosis is very easy to diagnose. It is hard in nature. It is a progressive swelling, so it won't come on a single day. Okay, you keep it in mind, it won't come on a single day. So the owner will be telling it is there for 1 week, it is there for 10 days like that. So unless otherwise, the snake envenomation, it is a sudden onset, and pit-on pressure will be there. In snake envenomation, it will be having pit-on pressure will be there. So hypoproteinemia, jowl edema will be there. The dependent part, a soft fluctuating swelling in the jowl. And in HS, hemorrhagic septicemia, there may be hard swelling in the throat region, submandibular region, with a congested mucous membrane, and respiratory distress will be there. Severe respiratory distress will be there in HS. And the edema of the face, the submandibular edema will be there, with the jugular vein engorgement will be there. I will show the pictures. Jugular vein engorgement will be there. That is called pericarditis. So by just palpation and appreciating the clinical sign, you can very easily diagnose the cases within few minutes. See here, there is a hard swelling of the mandible, which will be when you palpate, it's very hard in nature. When you put a needle, you can able to get a foul-smelling fluid from the swelling, and sometimes you'll be getting some sulfur-like granules will be there. That's a case of actinomycosis. Here also the swelling is very much obvious. The animal cannot able to chew the feed and the fodder thing, and the swelling is massive. So here also the swelling is very much extensive and particular to the mandibular region, which is hard in nature. It's all actinomycosis. The treatment of actinomycosis, you can give penicillin. So you can give penicillin, large dose of penicillin can be given. So you can give streptopenicillin 5 gram IM or 7.5 gram IM, or if you are giving plain penicillin alone, you can give penicillin, will be very much effective. Followed by potassium iodide should be given. Potassium iodide 10 gram orally for 10 days. That is the main thing. So potassium iodide is available from the chemical shop. So you have to get it from the chemical shop, and you have to give it as a 10 gram, as a 10 packets, you keep it, and daily you can take 1 packet which is having 10 gram and mix it with some electuary and give it orally. So then only excellent result will be there. Some practitioners, they used to give penicillin alone or antibiotics alone, but they won't give potassium iodide. The result won't be that much successful. And some of the cases, it will be having for a long period. I mean, more than 1 week. I mean, it will take more than 1 week. I mean, 7 days to 10 days it will be there, or it will take some 2 weeks also. It depends upon the intensity of the affection. Sometimes refractory cases, you can go for isoniazid 2.5 to 5 milligram per kg body weight orally for 30 days. But isoniazid should not be used in case of pregnancy. It should be avoided in case of pregnancy. If the animal is pregnant, you should not use it. Otherwise, you can use it as a sodium iodide gram per kg body weight, mix it with normal saline and give IV. Repeated at 1 week interval. So that also gives an excellent result. Usually the other antibiotics of preference or chlorphenicol or oxytetracycline can be also used. But the main thing, we used to have penicillin or streptopenicillin with the potassium iodide will gives a very good result for actinomycosis. Once it got ripened, you can open the swelling area and you can treat it as an abscess for the follow-up. See here, you can able to see the extensive swelling. So here the swelling is from the mandible to the brisket region, and here you have to differentiate from actinomycosis and pericarditis. How to differentiate from actinomycosis and pericarditis? In pericarditis, the jugular vein will be engorged. That you have to keep it in mind. The animal will be showing positive venous stasis test. How to see the positive venous stasis test? I will show the video. So venous stasis will be showing positive, and when you auscultate the heart, you will be getting abnormal heart sounds. In actinomycosis, venous stasis will be negative, the heart sounds will be normal, so that you can easily differentiate the actinomycosis and pericarditis. If you are having ultrasound facilities, it's well and good. We can appreciate very easily by ultrasound. So since we are attending the cases in the field conditions, we have to equip ourselves by appreciating the clinical signs. So here the swelling is in the submucosa region, soft, fluctuating in nature. When you palpate it, it is soft in nature. This is due to hyperproteinemia. Thus, see the mucous membrane. The mucous membrane will be blanched in that. So it is due to worm infestation, which leads to hyperproteinemia and duodenema. So what is the line of treatment? You have to deworm the animal. If the animal is anemic, you have to go for the blood transfusion. If the PCV is below 12, you have to go for the blood transfusion and supplementation of mineral mixtures and supplements and amino acids infusions can be given so that the animal can be slowly bringing back to normal. And here also the same thing, the extensive swelling in the brisket region, and see the jugular vein engorgement is there. So in this picture, you can able to see the obvious engorgement of the jugular vein. In all the clinical cases, don't forget to see the jugular vein. All the clinical cases, just as if you are seeing the temperature, mucous membrane, and the lymph node enlargement, and seeing the rumen motility, and asking the owner how about the dung or quantity it is passing, you have to observe the jugular vein in all the cases. Just by seeing the animal from the distance itself while walking, you can make the ensure that whether the jugular vein engorgement is there or not. Okay. So here the bilateral jugular vein engorgement is there. Sometimes you may be giving IV fluids. After giving IV fluids, the IV fluids might have got subcutaneous. So the owner might have pressed or giving fermentation the subcutaneous area, and the next day the animal will be having brisket edema, and this year also there will be edema will be there. That because of subcutaneous administration of fluids. So that will be localized to one area alone. So that edema will be present in one area alone. In pericarditis, the jugular vein will be engorged bilaterally, both the left side and right. The engorgement of the jugular vein will be there. So you have to keep your finger like this. See, here you can able to see the obvious engorgement of the jugular vein. You can prominently able to obviously appreciate the clinical sign. It is a clear case of pericarditis. So you have to keep your hand like this. So you have to keep your hand in the jugular vein, and normally the blood is blowing. See, you keep your hand in the jugular vein. Normally the blood is flowing from the head towards the cardiac chambers. So normal case, there will be bulging in the upper portion and there won't be any bulging in the lower portion. That is negative. How about this case? Here there is a bulging in both upper and lower area. So this is indicative of pericarditis. So here the venous stasis is positive. So there is bulging in both upper side and lower side, and it is a clear case of pericarditis. Just by seeing this clinical sign, you can come to a conclusion it is a case of pericarditis. Very easy to diagnose in case of field conditions. Okay. So you can able to see the jugular vein pulsating. So sometimes a normal and lean animal, it will be having pulsating, and you correlate with the clinical sign. Here the jugular vein engorgement is obvious and pulsating. You just keep your finger like this and see whether it is showing positive or not. If it is positive, it is clear case of pericarditis. In some cases, the scapula will be like this. The scapula will be spinning towards the outside as if it is very much emaciated. So some owners, they will be reporting it has been sudden onset. So you have to think about a few things. Either any pneumonia is there or not, any affections in the thoracic cavity, and you have to auscultate the lungs and the heart for any abnormal sounds, and you rule out pericarditis and foreign body syndrome. All these things we have to rule out in this type of cases. See here the scapula, it is abducted towards, the angle is deviated towards outside, and you can able to see the depression here. So you rule out any affections in the thoracic cavity. So if there is any reticular abscess, by seeing the heart rate, you can able to appreciate there will be elevated heart rate. Tachycardia will be there. So in such a condition, you think about any reticular abscess or pericarditis or pneumonia. All these things you have to think about by doing the clinical examinations. See here, the jugular vein is pulsating. It's not that much prominent, you can appreciate, but by keeping your fingers, we can easily appreciate the positive venous-stasis test. Just to keep your finger and see whether it is bulging or not. It's also a clear case of pericarditis. See, it's bulging here, upper portion, and also bulging in the lower portion. You auscultate the heart, you'll be appreciating the abnormal heart sounds. In the earliest phase, the animal will be having tachycardia. After that, the animal will be having a fluid splash, friction sound will be there during auscultation. And after some days, the animal will be having fluid splashing sound when you auscultate the heart. In terminal stage, the animal will be, you cannot able to appreciate the heart sound. That is called muffled heart sound. Okay. So there's various stages of pericarditis. So in the academic point of the view, many of will be as a students will be seeing the studying about the slope test. See, this is the slope test. See, the animal is walking down from the slope. Can able to see the same animal which is having pericarditis, which is walking very freely. Why I am insisting this? No. So these are all for academic point of view alone. By this slope test alone, you cannot able to come to a conclusion. I used to insist that alone because many of our friends during the discussion they used to say whenever the animal is coming down the slope very easily, so it is negative for any foreign body syndrome. It's not like that. Even if it is having foreign body syndrome, well, the concept is that when the animal is walking down, if it is having pain, the animal will be reluctant to walk. So by that they used to say this type of slope test is to identify foreign bodies. So don't depend or rely on the slope test alone. This is or wither pinch test alone. These are all the non-specific tests. Okay. This is a case of pericarditis, but walking freely. See, this is a case of pericarditis. See the brisket edema and the jugular vein engorgement is very prominent. See the jugular vein engorgement is very prominent. See the brisket edema is very much obvious. Brisket edema is a clear case of pericarditis. But when you make the animal in the slope, it's walking very freely. So you should not have a misinterpretation. Just as it is walking from the slope very freely, it is not a case of foreign body. It's not like that. You have to rely on clinical examination. That is what I want to insist you. Always you want to rely on the clinical examination like venous stasis positive and auscultation of the heart for appreciation of any other abnormal sounds like friction or fluid splashing sound or muffled sounds. Okay. So the next thing is regarding the another case. Okay, here the animal is reported with epistaxis. Either it may be a unilateral or bilateral epistaxis is there. So in such a cases, how to proceed these cases? For example, when you have a unilateral epistaxis, you will be differentiating from any injury. Just to rule out any injury in the nasal tract or any other head injury. Just you will be asking the history, and you have to palpate the nasal plane and the ethmoid area and all, and you rule out any fracture and all. So if you are having bilateral frothy nasal discharge, with the bleeding, epistaxis is there, you think about snake envenomation. So immediately you have to go for 20 minutes whole blood clotting time. 20 minutes whole blood clotting time. See, this is a case of snake envenomation having profused bleeding from both the nostrils. Another one is there, that is called caudal vena cava syndrome. So in that, the animal which are fed with more quantity of the concentrate and the sequelae of the acidosis that leads to formation of the hepatic abscess, that leads to caudal vena cava thrombosis. That will be onset, will be sudden. It won't be like this. Suddenly the animal will be having profuse bleeding from the nostrils, and immediately it will lie down and the death will be there. That is caudal vena cava thrombosis. So whenever you are getting epistaxis, bilateral or unilateral, you go for 20 minutes whole blood clotting time. See, you collect 1 or 2 ml of blood from the jugular vein in a syringe, 1 ml, 5 ml syringe, just 1 ml or 2 ml of blood, and keep it undisturbed for 20 minutes. Don't see it immediately. So collect 1 or 2 ml of blood without any anticoagulant. If you are having glass bottle without anticoagulant, it is well and good. If you are not having anything, you just take 1 ml of blood in a 5 ml syringe and keep it in a slanting position for 20 minutes. And after 20 minutes, you tilt like this and see. See, it is not clotted. If it is not clotted, it is a clear case of viper envenomation, snake envenomation, viper bite, because viper is a hemotoxic. Cobra and kite is a neurotoxic. So if it is having a viper envenomation, viper bite, the blood won't clot for even after 20 minutes. So you can proceed for the treatment. Okay, this is called 20 minutes whole blood clotting time. So I have seen when some of the practitioners, after collecting the blood and keeping it for slanting, in the 10 minutes itself they will take and they will shake it like that. You should not do it like that. After 20 minutes, you take it and gently tilt it, and you can see whether it is clotted or not. If it is not clotted, you go for treatment with the snake venom anti-serum. It is available as a 10 ml vial to like a liquid form is there. Another one is the powder form. Powder form with the reconstitute with distilled water with the water is there. You can reconstitute and you can mix it with the normal saline. Snake venom anti-serum you can give 2 vials. You can give 2 vials in one normal saline and give IV. Okay. So you should not give directly. The snake venom anti-serum should not be given direct IV. You have to mix it with the normal saline and give IV. Okay. So how to repeat it? You repeat it after 8 to 12 hours interval. 8 hours interval. You reevaluate the clotting time. If it is not clotted, repeat the treatment. Again go for 1 vial. And like that till it clots, you can go for the treatment with the snake envenomation. Okay. See here, the other accessory treatments include administration of antibiotics and fluid therapy can be managed well for the snake envenomation. And regarding the cobra and kite, this whole blood clotting time does not play a role for neurotoxicity. So there, according to the swelling is obvious. According to the swelling, the treatment schedule will be repeated. So the swelling is reduced and will become normal. You can stop the administration of the snake venom anti-serum. Some cases you will be getting epistaxis like this. Sometimes you may be getting a mild discharge from the blood tinged discharge from the nostrils, not profused, and it will go for 1 or 2 days. It will be normal. Sometimes again the discharge will be coming. Again it will be coming. So it will be like that for few months. So the owner will be telling it is since for 1 month, 2 months like that. The history will be saying. Any other clinical signs can you able to appreciate in this animal apart from this epistaxis? Can you able to concentrate on the eyes? See, the eyeball is protruded outside. So you can correlate with the other eyes. So the eyeball is very much protruded. So it's a clear case of ethmoid tumor. There is a progressive tumor in the ethmoid area. Here, inside the nostrils in the ethmoid area, there is a progressive tumor is there that leads to the protrusion of the eyeball and constant mild bleeding will be there from the nostrils. Okay. See, the protrusion of the eyeball, exophthalmos is very much obvious in this case. So ophthalmos will be, exophthalmos will be there, blood tinged fluid will be coming. I mean, the discharge will be coming. So when you see the nasal patency, the nasal flow won't be there. All these signs are suggestive of ethmoid tumor. So the other differential diagnosis includes schistosomiasis. In schistosomiasis, there won't be any protrusion of the eyeball. Nasal granuloma, there won't be any protrusion of eyeball. All these things you have to keep it in mind and you go for the differential diagnosis. See here, the protrusion of the eyeball is obvious. So this is a nasal patency. This is how by keeping a small thin piece of cotton with forceps, just you can keep it in front of the nostril and you can see the patency, nasal flow, whether the air respiration pattern is coming or not. If there is any complete obstruction, you cannot able to, the nasal patterns will be completely absent. The airflow will be completely absent in case of ethmoid tumor or any other lesions present. In some cases, the protrusion of the conjunctiva will be there. I mean, there won't be any protrusion of the eyeball, but the eyelid swelling will be there. With the perineal swelling will be there. That is due to angioedema. So that due to any other allergy condition. Any allergy conditions means it will be bilateral in nose. Bilateral swelling of the eyelids and the swelling of the perineum will be there. That you have to differentiate clinically. See here, the eyelid is swelling. The eyelid is swollen. Both eyelids are swollen. This is due to angioedema, allergy condition. In this such a cases, just to give antihistamine, then will become normal. So this is angioedema, swelling of the vulval lips and the perineum. Sometimes it may occur in angioedema by feeding some unwanted, I mean, weeds. Even sometimes it may be getting in mimosa pudica, mimosa indica, mimosin toxicity also. There will be edema like this in the vulval region. The other one, the next thing is here the clinical signs. What are all the clinical signs can you able to appreciate? See, the animal is having extended neck. As I already told, any animal which is having extended neck, it will have, you have to differentiate any affections of the thoracic cavity. First, you rule out any affections of the thoracic cavity. What are all the affections in the, what are all the organs which are located in the thoracic cavity? Lungs, mainly the lungs. You rule out pneumonia or aspiration. Then in the intrathoracic, I mean the intra-abdominal in the thoracic area, the other affections, the reticulitis or reticular abscess, pericarditis, all these things you have to keep it in mind and you have to clinically examine and you can very well differentiate. So any animal which is presented with the extended neck, as I already told, extended neck with the profuse salivation and choke is there, means you have to think about this one. Extended neck and profuse salivation means you have to think about aspiration, this choke material. Choke, you have to think about the choke. Okay. So here, the animal is having oral respiration, and the oral respiration is there. So animal having oral respiration, and it's a clear case of aspiration pneumonia. And this is subcutaneous emphysema. When you palpate the, when you are palpating the subcutaneous tissues, see, crepitation will be there. So crepitation will be there. So this is subcutaneous emphysema. So you have to think about any aspiration pneumonia and foreign body syndrome that you have to take in care. So the prognosis depend upon the treatment. So for example, the animal is recovering well during the part of the treatment. For aspiration pneumonia, you will be treating the animal with ceftiofur sodium, flunixin and furosemide. The animal will respond well to the treatment. And see here, the response to the treatment, when the animal start taking feed and respiratory distress is reduced, that indicates the animal is recovering well for the treatment. So this is another one. See here, the animal is having respiratory distress, labored breathing is there, and you have to auscultate the heart and see whether there is any exaggerated lung sounds or aspiration pneumonia is there. And this case is due to hairy panther. This is FMD recovered animal, FMD affected animal recovered from FMD. So it's having respiratory distress like this. So the other thing, whenever you are coming a case of not passing dung, so you have to do the rectal examination. Whenever the ST is telling that the animal is not passing the dung, you have to go for the rectal examination and do the rectal examination and see whether the animal is passing dung or not. If you are having like this, complete absence of the dung is an indicator of intestinal obstruction. When you are having a complete absence of dung during the rectal examination, it is a clear indication of intestinal obstruction or intersusception. See here, the rectal mucosa is protruded very much, and this is also a clear indication of intestinal obstruction. So sometimes rectal contents will be raspberry jam in nature. The rectal contents will be raspberry jam in nature, and this is also a clear case of intersusception or intestinal obstruction. See, raspberry jam like thing is a clear case of intestinal obstruction. So this case of intestinal obstruction having colic signs. The animal is showing colic signs. It's kicking the belly frequently, kicking the belly with the hind limbs is showing colic signs. So the tail is elevated, and you have to do the rectal examination. Rectum is empty, and you can palpate the any intestinal obstruction or intersusception mass present. Sometimes you may be doing the rectal examination. You will be getting this type of material, which is indicative of abomasal ulcers. So abomasal ulcers will be dark tarry color pieces will be indicative of abomasal ulcers. So these things are available. So like this, you are getting which it's a case of abomasal ulcers. So the outcome of the ileus, normally the reduced quantity of the dung is indicative of poor stomach disorder, or you have to think about peritonitis. Complete absence of the dung, you have to think about intestinal obstruction or intersusception. So you treat it with the purgatives like magnesium sulfate and sodium chloride. Magnesium sulfate 500 gram with the sodium chloride 250 gram, and you can drench it, and you can wait it for 6 to 8 hours and give the fluid therapy, and you can go for any other prokinetic drugs also administered and see whether the animal is passing the dung or not. In ordinary impacted cases, the animal will pass the dung very within 1 or 2 days, and if it is having peritonitis, it won't respond to any of our treatment. So this is the infusion set, large animal infusion IV set, which can be very well useful for the large animal fluid therapy, which was made by our Professor Vijay Kumar, and which was very much useful in the large animal practice. So you can within 5 minutes, 5 to 10 minutes, you can give 5 to 6 liters of fluid for the large animal. You can get it from our college. See here, the another one is the important thing is the abdominocentesis. 2 techniques we have to keep it in mind. This is the caudal abdominocentesis. Just in the right side, don't go for the left side, because in the left side, rumen is there. In the right side, you just pull the flap and insert the needle. See, there is a free flow of peritoneal fluid. This is the caudal abdominocentesis. It's a very good diagnostic aid. Okay, where you can easily diagnose the peritonitis. So it's a caudal abdominocentesis. Normally there won't be any peritoneal fluid in the abdomen. When you put the needle, see, this is the cranial abdominocentesis. See? See, from the xiphoid, 10 centimeters caudal, 5 centimeters lateral. When you put the needle, there is a free flow of peritoneal fluid. It won't respond to any of our treatment of purgative or fluid therapy. The dung won't be passed out. So by using the 16 gauge or 18 gauge needle, just you can put the needle in the ventral abdomen and rule out peritonitis. See, this is also another one animal which is brought with the history of not passing the dung. See the site of abdominocentesis, 10 centimeters caudal from the xiphoid. You can put the needle and you can rule out peritonitis. Any free flow of peritoneal fluid, it's indicative of peritonitis. Just see the pH. If it is acidic in nature, it is abomasal fluid. If it is alkaline in nature, it is peritoneal fluid. The other one is case discussion regarding the, you can see the petechial hemorrhages. See, the vaginal mucosa is pale in nature, slightly ectric with the petechial hemorrhages. It is a clear case of thalariosis. See, the mucous membrane is pale in nature, and you can able to hear in this, you can able to appreciate the small petechial hemorrhages in the mucous membrane. And here you can able to appreciate the ecchymotic patches in the vaginal mucous membrane, and also ectric in nature. Can able to see the ecchymotic patches. See the patches of petechiation means it's a pinpoint hemorrhages. Here ecchymotic patches. So in very severe anemic animals, if you keep your hand like this in the scapular region, you can able to appreciate the pulsating of pulsation in the scapular region, which indicates a very much anemic. That also very much appreciable. As if you are auscultating the abdomen, as a thudding of aorta will be noticed. The same thing here. You can able to appreciate the blanched paleness of the udder. See, the udder is blanched and pale. All these signs of blood protozoan disease, especially anemia due to thalariosis. The blanched mucous membrane. See here, the petechial hemorrhage is very much obvious. When you are appreciating any clinical signs like this, you can very well easily appreciate this is a case of thalariosis, petechial hemorrhages or ecchymotic. See, the ecchymotic patches very much obvious in case of thalariosis. So you can treat it well with bupropion, and 2.5 milligram per kg body weight bupropion can be administered intramuscularly, and oxytetracycline for 3 to 5 days. The animal will recover very eventfully. And if the animal is very much anemic, if the PCV is less than 12, you have to go for the blood transfusion. So when you are getting a coffee colored urine, you have to rule out babesiosis. The animal which is having temperature with the coffee colored urine, rule out babesiosis. In some cases, the animal may be normal, having feeding habit, everything normal, and all the vital signs, everything normal, but the animal will be passing hemoglobinuria. That is due to phosphorus deficiency or postparturient hemoglobinuria. So accordingly, you treat it. The animal is having babesiosis, you treat it with diaminosin aceturate, 3.5 milligram per kg body weight, intramuscular. If it is due to phosphorus deficiency, you supplement sodium acid phosphate orally. See, this is a case of hemoglobinuria. See the color and the intensity. The color is coffee colored in nature. During the treatment process, it will change like this. This is also coffee colored urine. So treat it with the sodium acid phosphate, 60 gram in normal saline IV and 60 gram in subcutaneous. And also sodium acid phosphate or sodium dihydrogen phosphate can be given 100 gram orally. So sodium acid phosphate can be given 100 gram orally. The animal will recover within 3 to 5 days now. So if it is very much anemic, if the PCV is less than 12, you can go for the blood transfusion, and blood transfusion is very much helpful for saving the animal in large animal practice. You can use the acid citrate dextrose solutions for 1 ml for 7 ml of blood. 1 ml for 7 ml of blood you can use, and also you can use heparin 5 units per ml of blood can also be used, or you can use the ACD solutions can be used, and you can use the sterile glass bottle or the saline bottle, and you can very well collect it from the donor and you can give it to the affected animals. So this is another case regarding the case discussion. You can able to see the udder. The udder is very much distended. It's a recently cowed animal. Yesterday the animal is cowed and the udder is very much distended, and you can see the udder. The udder is below the hock joint. So there are two ligaments, the lateral suspensory ligament and medial ligament is there, which are attaching the udder to the abdomen. Here there is a rupture of the lateral suspensory ligament. So the udder becomes distended below the hock region. Okay. So you have to differentiate from physiological udder edema. So physiological udder edema, it will form just prior to the cowing or at the time of cowing or immediately after cowing, and it will respond well to your routine treatment with the diuretics like furosemide you can give, or otherwise you can give acetozolamide tablets are available. You can give 2 gram BAD. Acetozolamide tablets are available. You can give 2 gram BAD, or furosemide can be administered, and it will be slowly subsided. When you start milking, it will be subsided slowly in 2 to 3 days or 1 week. It will be normal. Even after 1 week, it is not normal. If it is distended like this, you have to think about rupture of the lateral suspensory ligament. See here, the udder is below the hock joint, and it is due to the rupture of the lateral suspensory ligament. See here, here is the medial ligament. So when there is any rupture of the medial ligament, all the 4 teeth will be having outward angle will be there. So like that, just by seeing the clinical signs, we can able to diagnose. So in this case, the animal is having frequent protrusion of the tongue and the salivation, and immediately you should not mistake it as a ketosis or hypermagnesemia. So you have to go for the oral cavity examination and appreciate what is the problem. See here, this animal is affected with FMD. That's why, because of the oral ulcerations, the animal is protruding the tongue frequently with salivation is there. So only after the clinical examination, you have to go for the diagnosis and treatment. Just by seeing that the animal is protruding the tongue frequently, you should not mistake it as a case of ketosis or hypermagnesemia. See the ulcerations on the tongue, very obvious. So the take-home message is, you have to go for the clinical examination. Oral cavity examination is needed. See here, the other video here. In some cases, the animal will be having protrusion of the tongue frequently. The continuous protrusion of the tongue frequently will be there. All other vital signs will be normal. Everything will be normal. Feeding habit will be normal, but the animal will protrude the tongue as long as outside, and it will be doing like frequently. Some owners might be reporting that. That is due to a behavioral problem. That is isolated, or this one. It's a stereotypic behavior, lonely behavior. Animals which are kept in a farm, or sometimes when they are kept alone, that may lead to some vices and behavioral problem that will lead to this type of tongue loading. And you have to get the history and clinically examine it and correct it. So thank you very much for your patience hearing. Thank you very much.